Osteomyelitis is defined as inflammation of the bone. Now talk about malignant otitis externa. The skull-base osteomyelitis is a rare complication of otitis externa. It is a vicious infection in which the soft tissue pathogen has spread to the periosteum and temporal bone of the skull, causing necrosis. This may be associated with involvement of facial nerve, carotid artery, jugular vein, including the bulbar and hypoglossal nerves. The infection may then progress to other bone of the skull base. So it can extend anywhere between the frontal bone to the occipital bone and mainly involve the temporal bone region because of its initiation from otitis externa from external auditory canal, and they present as granulation tissue classically in the floor of external auditory canal. The condition first described in 1959 by the Meltzer and Kelemen, who named it pyocutaneous osteomyelitis of the temporal bone, and Chandler giving the term malignant otitis externa in 1968. So, Chandler giving the term malignant otitis externa. The This mainly affect elderly and diabetic patient. If you see clinically, they should be diagnosed by the clinical feature microbiology of the culture, radiology of the skull bone, and histological examination of the tissue. So it is a mainly clinical diagnosis plus culture plus imaging diagnosis. In diabetic, because of end arteritis, microangiopathy, and small vessel obliteration in the diabetic lead to the decrease in humoral immunity, which ultimately leading to spread of this infection. The clinical feature, there is otalgia and lancinating disproportional pain on the region and ear canal. And prevalence is, if we see, there is classical granulation tissue in the external auditory canal of patient of skull base osteomyelitis. These patients are mainly diabetic, and main infection leading to this condition is Pseudomonas aeruginosa. Because in diabetic there is this aeruginosa having the cerumen having high pH level in external auditory canal, and immunity is low because of decrease in humoral immunity, leading to this granulation tissue and spread of the Pseudomonas infection. The facial nerve is most commonly affected because of its location in the middle ear. The children with skull base osteomyelitis usually develop facial nerve palsies earlier due to their more medial fissure of Santorini and their underdeveloped mustard process. So children are most commonly affected by this. Other bacteria, Staphylococcus aureus, Staphylococcus epidermidis, and fungal infection is also common cause of this. Leading most common infection is Aspergillus fumigatus. If clinopathological classification, if it is localized to external auditory canal, it is grade 1 with negative scan. Grade 2 is soft tissue infiltration with positive scan. Grade 3 is A if single cranial nerve involved, B is multiple cranial nerve is involved, and grade 4 is if it is going into the intracranial or skull base osteomyelitis spread to beyond the territory of the middle ear, then it is grade 4. So this is clinopathological classification of facial nerve, mainly radiologically. If you see, it is clinopathological classification. The all imaging modalities are reliant on the experience and confidence of the radiologist reporting the CT or MRI of the patient. And you see classically technetium 99 scan and other, if you see the CT scan and MRI of these patients, they will show soft tissue density and the classical hypointense region of inflammation is there on the MRI. The gallium 67 citrate scan is often utilized to monitor treatment of response. So for diagnosis, you should do gallium 99 scan and technetium 99 scan. Technetium 99 scan is mainly used for diagnosis and gallium 67 scan is mainly for monitoring of the disease. Now treatment. First you do oral toileting, you clean the ear, and main is control the diabetic and your sugar should be below 200. Systemic antibiotic, you should give double antibiotic like ciprofloxacin and ciprotexim or double antibiotic. Third generation cephalosporin and quinolones are should be given to cure the disease. If disease is very severe, you can add hyperbaric oxygen therapy. It's surgery only indicated and limited to the debridement of tissue, taking the biopsy to rule out the malignancy. So surgical role is very limited. So this is all about malignant otitis externa. You can monitor this disease by monitoring the ESR or CRP level every alternate day.